Your body warns you months before a stroke, but most seniors miss these early signs. Imagine waking up one morning feeling completely fine. You make your coffee, you sit down in your favorite chair, maybe you glance out the window at the yard. Everything feels normal. And then, without any warning, or at least what feels like no warning, someone you love collapses. Or maybe that someone is you. And the doctors in the emergency room say the same thing they say to thousands of families every single year. There were signs. There were always signs. That sentence, those 5 words, they haunt people. Because the truth is, your body does not stay silent before a stroke. It speaks, it whispers, and sometimes it even shouts. But most of us have never been taught to listen. Here's something that will stop you cold. Every 40 seconds, someone in the United States has a stroke. Every 40 seconds. And nearly 80% of all strokes are considered preventable. Not treatable after the fact. Preventable before they ever happen. So why are so many people still being blindsided? Why are families still sitting in hospital waiting rooms completely stunned, saying, "We had no idea"? The answer isn't a lack of medical research. The answer is a lack of the right information reaching the right people at the right time. And that is exactly why we're talking about this today. This is not going to be one of those videos that lists a few obvious symptoms and sends you on your way. What we're going to talk about are the quiet, easy to dismiss, often misunderstood signals that your body sends out weeks, and sometimes months, before a stroke actually happens. These are the signals that most people chalk up to aging, stress, or just a bad day. These are the ones that fly completely under the radar, and by the time you finish watching this, you will never look at them the same way again. Before we go any further, if you're finding this valuable, if you feel like this is the kind of information someone you care about needs to hear, please take just a second and hit the like button and subscribe to Dr.Selric. We put out content like this because we genuinely believe that the right knowledge, delivered at the right moment, can save lives. And we mean that. So stay with us, because what comes next might be the most important thing you watch all week. Let's start with something that almost nobody talks about, and that is the connection between your sleep and your stroke risk. Most people know that high blood pressure is dangerous. Most people know that smoking is a risk factor. But very few people realize that disrupted sleep, specifically a condition called sleep apnea, dramatically increases your risk of having a stroke. We're talking about a risk that's 2 to 4 times higher than average. And here's the terrifying part. Most people who have sleep apnea don't know it. They just think they snore a little. They just think they wake up tired. They blame it on getting older. They blame it on stress. But what's actually happening is that their blood oxygen levels are dropping repeatedly throughout the night, putting enormous strain on the blood vessels in the brain. Over time, that strain adds up. And one day something gives. If you or someone you live with snores loudly, gasps during sleep, wakes up with headaches in the morning, or feels exhausted no matter how many hours they spend in bed, please don't brush that off. That is your body trying to tell you something, and a simple sleep study can catch it. Treating sleep apnea has been shown to significantly lower stroke risk. Something so treatable, and yet so overlooked. Now here's where things get really interesting, and a little bit unsettling. There is a type of event called a TIA, which stands for transient ischemic attack. Doctors sometimes call it a mini-stroke. But that name is misleading, because there is nothing mini about what a TIA means for your future. A TIA happens when blood flow to part of the brain is briefly interrupted. The symptoms may last only a few minutes. They may resolve on their own completely. And because they go away, most people think, "Okay, that was weird, but I'm fine now." They don't call a doctor. They don't go to the emergency room. They pour themselves a glass of water and sit down and wait for it to pass. And it does pass, and they move on. But here's what they don't realize. After a TIA, the risk of having a full stroke within the next 2 days is somewhere between 10 and 15%. Within the next 3 months, that risk climbs even higher. A TIA is not a close call that you walk away from unscathed. It is a 5-alarm warning signal. It is your brain telling you in no uncertain terms that something is wrong with your blood flow and it needs attention right now. Not tomorrow, not after the weekend, right now. The symptoms of a TIA look almost identical to a full stroke. Sudden weakness or numbness in the face, arm, or leg, especially on one side of the body. Sudden confusion or trouble understanding what people are saying. sudden vision changes in one or both eyes, sudden severe headache with no known cause, sudden difficulty walking, dizziness, or loss of balance. The difference is that with a TIA, these symptoms fade, and that fading is what tricks people into thinking everything is fine. Everything is not fine. If you experience any of these symptoms, even briefly, even if they go away completely, you need to seek emergency medical care immediately. Time in this situation is everything. Now let's talk about something that affects millions of American seniors and that almost nobody connects to stroke risk, and that is chronic loneliness and social isolation. You might be thinking, what does loneliness have to do with a stroke? More than you could imagine. Research out of some of the most respected medical institutions in the country has found that chronic social isolation is associated with a significantly elevated risk of stroke and heart disease. In fact, some studies suggest the health impact of loneliness is comparable to smoking 15 cigarettes a day. 15 a day. When a person feels chronically isolated, the body responds with prolonged stress responses. Cortisol levels stay elevated, inflammation increases, blood pressure climbs, the immune system weakens. All of these things over time damage the blood vessels. They make the blood more prone to clotting. They weaken the heart. And together, they create exactly the kind of internal environment where a stroke becomes far more likely. So if you know someone who lives alone, who rarely gets out, who seems cut off from the people and activities they used to love, please don't just worry about their mood. Worry about their health. Because loneliness is not just an emotional problem, it is a physical one. Here's another warning sign that almost never makes the list, and yet it appears in the medical literature with startling regularity. Sudden, unexplained changes in personality or behavior. We're not talking about someone becoming grumpy because they had a bad day. We're talking about noticeable, out-of-character shifts. A person who was always patient suddenly becomes irritable and impulsive. Someone who is warm and social becomes withdrawn and flat. A person who is sharp and detail-oriented starts making strange decisions or seems confused by things that would normally be simple. These changes can happen gradually, over weeks or months, as small areas of the brain are affected by reduced blood flow that hasn't yet caused a full stroke. Doctors call this vascular cognitive impairment, and it is far more common than most people realize. The trouble is, families often attribute these changes to normal aging, or depression, or stress, and sometimes it is those things. But sometimes, and this is the part that matters, those behavioral changes are the brain sending a distress signal. If you've noticed a significant shift in someone close to you, or in yourself, that can't be explained by life circumstances alone, it is worth bringing up with a doctor. Not in a frightened, catastrophizing way, just honestly. Just as a question worth asking. Let's shift to something that a lot of seniors experience and rarely mention to their doctors because they're embarrassed, and that is sudden, significant episodes of dizziness or vertigo. Now, dizziness is incredibly common. It can be caused by dehydration, inner ear issues, medication side effects, getting up too fast, all kinds of things. And most of the time, that's exactly what it is. But there is a particular kind of dizziness that is different. It comes on suddenly. It may be accompanied by nausea, difficulty walking, or a strange feeling of the world tilting around you. And it doesn't have a clear, obvious trigger. This type of dizziness, especially when it comes and goes over days or weeks, can be a sign that the part of the brain responsible for balance and coordination is not getting enough blood. The vertebro-basilar system, which supplies blood to the back of the brain, is responsible for balance, coordination, vision, and swallowing. When this system is compromised, one of the earliest signs can be recurring bouts of dizziness or unsteadiness that seem to come out of nowhere. People dismiss it. They buy better shoes thinking it's a balance issue. They take over-the-counter remedies for nausea. Meanwhile, the real problem is quietly progressing. There is also something called amaurosis fugax, which sounds complicated, but what it means is a temporary loss of vision in one eye. People describe it as a shade or curtain being pulled down over one eye for a few seconds to a few minutes, and then lifting. It doesn't hurt. It passes. And most people assume it was just a weird visual thing. Maybe they looked at something bright. Maybe their eyes are tired. But this symptom is a classic warning sign of a problem with blood flow to the eye, which is supplied by the same artery system that feeds part of the brain. If this has ever happened to you, or if you know someone who has described something like this, please take it seriously. Do not wait to see if it happens again. Go to a doctor. Now let's talk about something that is hiding in plain sight in millions of American medicine cabinets, and that is the issue of certain medications and stroke risk. Most people assume that if a medication was prescribed by their doctor, it's safe, and they don't need to think too hard about it. But the reality is that medication interactions, especially in seniors who may be taking multiple prescriptions, can significantly affect stroke risk without anyone realizing it. Certain blood pressure medications, when stopped suddenly or taken inconsistently, can cause dangerous spikes in pressure. Certain decongestants, the kind you find at any drugstore, can temporarily raise blood pressure to concerning levels in people who are already vulnerable. Even some supplements that seem perfectly harmless, like high-dose fish oil combined with blood thinners, can affect how the blood clots. This is not meant to frighten anyone away from their medications. It is meant to encourage a simple, honest conversation with your doctor or pharmacist about everything you're taking: prescription, over-the-counter, and supplement. Bring a list. Ask if anything you're taking affects blood pressure or clotting. Ask if the combination of what you're taking has ever been reviewed. It sounds like a small thing. It is not a small thing. There's a myth that strokes only happen to people who are visibly unhealthy, people who are obviously overweight, or who have never exercised a day in their life. But the truth is much more complex and, for many people, much more shocking. Strokes happen to people who run marathons. Strokes happen to people who eat carefully and maintain a healthy weight. Why? Because there are risk factors that have nothing to do with your lifestyle habits. Atrial fibrillation, an irregular heart rhythm, is one of the most significant stroke risk factors that exists, and it often has no symptoms whatsoever. It can be detected only with an EKG or a heart monitor, and it's estimated that millions of Americans are walking around right now with undiagnosed atrial fibrillation, completely unaware. When the heart beats irregularly, blood can pool in certain chambers and form clots. Those clots can travel to the brain and cause a massive stroke with absolutely no warning. None. This is why regular checkups, including listening to the heart and checking the pulse rhythm, matter so much. Even when you feel perfectly fine. Especially when you feel perfectly fine. Let's talk about headaches, because this is another area where the difference between ordinary and alarming gets dangerously blurred. Tension headaches and migraines are incredibly common. Most headaches are benign. But there is a type of headache that neurologists and emergency medicine doctors describe as a red flag, and it is called a thunderclap headache. It earns that name because it comes on in an instant, not building gradually the way most headaches do, but arriving at full, unbearable intensity within seconds. People who have experienced one often say it was the worst pain of their life, completely unlike any headache they'd ever had before. This type of headache can be a sign of bleeding in or around the brain. It is a medical emergency and needs to be treated as one. But there's another, less dramatic headache pattern that also deserves attention. Some people in the weeks or months before a stroke begin experiencing headaches that are different from their usual ones. Different in location, different in character, different in timing. Not necessarily severe, but different. If your headaches have changed in a way that you can't explain, that's a conversation worth having with a doctor. Something that almost nobody mentions in these conversations is the role of your neck. Specifically, a condition called carotid artery disease. The carotid arteries run up either side of your neck and supply blood to the front and sides of the brain. When these arteries become narrowed by plaque buildup, blood flow to the brain is compromised. And unlike some conditions that announce themselves loudly, carotid artery disease is often completely silent until it causes a stroke or TIA. A doctor can sometimes detect the turbulent blood flow through these narrowed arteries by listening with a stethoscope, a sound called a bruit. This is one more reason why regular checkups, where a doctor is actually listening to your neck and not just asking how you feel, can catch something that would otherwise be invisible. There is also the matter of blood sugar and its relationship to brain health. We know that diabetes is a major risk factor for stroke. Most people are aware of that connection. But what is less widely known is that even pre-diabetes, elevated blood sugar that hasn't yet crossed into a diabetes diagnosis, significantly increases stroke risk. And the way that pre-diabetes tends to show up is in subtle ways that are incredibly easy to miss. A little more fatigue than usual, some increased thirst, healing that seems slower than normal, occasional blurry vision. Not dramatic symptoms. Not symptoms that would send anyone rushing to the doctor. Just a quiet background hum of your body struggling to manage sugar levels efficiently. And all the while, that elevated sugar is damaging blood vessels, including the ones in the brain. If it has been a while since you've had a fasting blood sugar test, or if you have some of the risk factors, family history of diabetes, weight around the midsection, a sedentary lifestyle, please ask your doctor about getting checked. Prediabetes is reversible. Catching it early genuinely changes the picture. Now we want to take a moment to talk about something that has been happening quietly in the background of all of this, and that is stress. Not the ordinary, everyday kind of stress that comes and goes. We're talking about chronic, unrelenting stress, the kind that lives in your chest and your shoulders and your jaw, the kind that doesn't really go away when you go to bed at night. Chronic stress keeps your nervous system in a constant low-grade state of alarm. Cortisol stays elevated. Inflammation stays elevated. Blood pressure stays elevated. And over time, all of that elevation takes a toll on the cardiovascular system that is very real, very measurable, and very dangerous. Here's the part that's particularly relevant for the senior community. Stress in older adults often looks different than it does in younger people. It may not look like anxiety. It may look like withdrawal, fatigue, irritability, a quiet heaviness that people just accept as part of getting older. But it isn't something that should simply be accepted. There are real, practical ways to interrupt the stress response, and we're not talking about elaborate or expensive interventions. Something as straightforward as slow, deliberate breathing, the kind where your exhale is longer than your inhale, can activate the parasympathetic nervous system and lower blood pressure in real time. Not as a replacement for medical care, but as something you can actually do today that genuinely helps. Let's talk for a moment about hydration, because this one surprises people. Dehydration, especially in older adults, is more common than most people realize, and it can meaningfully affect stroke risk. As we age, the sensation of thirst becomes less reliable. We genuinely don't feel thirsty as strongly as we once did, even when our body is short on fluids. And when the body is dehydrated, the blood becomes thicker and more prone to clotting. For someone who already has risk factors for stroke, that added thickness in the blood can be the thing that tips the balance. The recommendation that most people have heard, 8 glasses of water a day, is a simplification, and the actual amount varies by person, by activity level, by climate. But the broader principle holds. If you're not intentionally drinking fluids throughout the day, there's a good chance you're chronically slightly dehydrated, especially if you're taking medications that have a diuretic effect, which many blood pressure medications do. Talk to your doctor about what adequate hydration looks like for your specific situation. It sounds almost too simple to matter, but for stroke prevention, it is not something to overlook. Here is something that the medical community has only recently started talking about more openly, and that is the connection between depression and stroke risk. For a long time, depression was understood as a consequence of stroke, something people struggled with after a stroke, as they adjusted to its effects. And that is true. But the relationship also runs the other direction. People who experience depression have a significantly elevated risk of stroke compared to those who don't. The exact mechanisms are still being studied, but the leading theories involve inflammation, changes in blood clotting, the effect of stress hormones on blood vessels, and the ways that depression can affect other health behaviors like sleep, diet, and medication adherence. This does not mean that having depression means a stroke is inevitable. It does not mean that. But it does mean that treating depression, with therapy, with medication, with lifestyle changes, with community and connection and support, is not just about mental health. It is about physical health. The mind and body are not separate systems. What happens in one affects the other in ways that are deeply real, even if they're sometimes invisible. Now let's bring this closer to home. We want to talk about what you can actually do, not in some vague, abstract way, but in practical, specific terms, starting today. The first thing, and this is arguably the most important, is to know your numbers, your blood pressure, your blood sugar, your cholesterol. These 3 things together paint a picture of your cardiovascular health that no amount of feeling fine can substitute for. If you don't know your numbers, make an appointment. If you know your numbers and they've been creeping in the wrong direction, take that seriously. Those numbers are your body talking. The second thing is to talk honestly with your doctor about your full medication list, including everything over the counter and every supplement. Not just once, every time something changes. Third, if you or anyone you live with is a known or suspected snorer or wakes up feeling unrested despite sleeping enough hours, bring up sleep apnea. Ask for a sleep study. It is non-invasive, it is often covered by insurance, and the results can be genuinely life-changing. Fourth, movement. Not marathon training, not intense gym sessions. Movement. Walking, gentle stretching, swimming, dancing in your living room to a song you love. The research on what regular, moderate physical activity does for blood vessel health and blood pressure control is overwhelming. And some of the benefits start showing up very quickly, not after years of disciplined exercise, but within weeks of consistent, gentle movement. Fifth, and this one matters more than most people give it credit for, connection. Maintaining relationships, staying engaged with people. It doesn't have to be a large social circle. It can be a few close friendships, a weekly phone call, a community group, a volunteer role, a faith community. Whatever form it takes, the act of being genuinely connected to other people has measurable, documented benefits for cardiovascular health that are real and significant. And sixth, know the warning signs. The FAST acronym has been shared widely, and for good reason. Face drooping, arm weakness, speech difficulty, time to call 911. But we want you to hold even more in your mind now. The transient episodes that pass, the sudden visual changes, the thunderclap headache, the personality shifts, the recurring unexplained dizziness. These are not dramatic in the moment. That's the whole problem. They're easy to explain away. They're easy to forget. They're easy to mention to a spouse and then move on from. Don't move on. Write it down. Make a doctor's appointment. Your future self may thank you in ways that are impossible to fully express. We've covered a lot of ground today, and it may feel like a lot to hold on to. But the thread running through all of it is the same. Your body talks. It has a language, and it uses that language all the time. The gap between a stroke that devastates a life and a stroke that never happens is often not about medicine that didn't exist. It's about signals that weren't recognized, about appointments that weren't made, about a hesitation that felt reasonable at the time but turned out to be costly. You watching this right now, that is not a passive act. That is you choosing to be informed. That is you taking your health seriously. And if anything in this video gave you pause, if anything made you think of someone you love or something you've been meaning to look into, please don't let that feeling fade when this video ends. Write it down, send a text, make the call. Do the one small thing that moves you from "I should" to "I did." We'd love to hear from you in the comments. Have you or someone you care about ever experienced a warning sign that turned out to be significant? Did something you heard today surprise you or change the way you're thinking about your health? Your story might be exactly what someone else in this community needs to read today, so share it. And if you know someone, a parent, a sibling, a dear friend, who should hear what was said in this video, please share it with them. You might be doing something more important than you realize.